Ready? Okay. Thank you guys so much for coming out tonight. You guys all know I'm Amy, and I'm going to be talking about thyroid and why thyroid optimization matters. Thyroid disease affects about 40% of the population worldwide, and about 1 in 8 women develop thyroid disease in their lifetime. 60% of patients are unaware that they have a thyroid problem. The thyroid controls basically everything, but metabolism, especially fat metabolism. Your heart rate, your temperature regulation, and your energy levels all come from your thyroid. Your brain, we're talking about mood and fatigue. Skeleton, we're talking about osteoporosis. Skeletal muscle, your energy. Glucose metabolism and fatigue come from the skeletal muscle. Adipose tissue, that's going to be your lipid homeostasis and your lipid metabolism. Liver, this is where our T3 production actually happens, and glucose metabolism happens here as well. It also works with our thyroid and pituitary axis that we have, heart and circulation, and pancreas with insulin control. Thyroid hormone affects every single cell of your body. It's going to tell how fast or slow your heart's beating, how much you burn calories. It helps with follicle and embryo development. It's going to help deal with your temperature of your body. It helps move food through your digestive system, sperm and testosterone production, the way muscles contract, the new rate of cells that it does cellular turnover, so new rates of cells and old cells and how fast they turn over. The thyroid is going to naturally decline with age. Also, stress levels are going to adversely affect your thyroid level, especially cortisol, and exposure to different toxins from foods and the environment. Symptoms of hypothyroidism are all-encompassing. Because it affects every cell in your body, you're going to get symptoms in almost every body system that we have. So when we have hypothyroidism, we can get weight gain. We have decreased appetite. So that's where your patients are talking about, I'm not barely eating anything, but I'm still gaining weight, or I'm still overweight and I can't lose weight. You're going to have decreased core body temperature. Therefore, you're going to have cold intolerance. You're going to have sensitivity to the cold. Your heart rate can go down. You can develop hypertension as a reflex of the arteries getting firmer, and we'll talk about that later. A lot of issues with constipation and poor digestion. It's also going to feed into fatigue, depression, anxiety, memory impairment, concentration issues, and mental fog. Dry skin, brittle nails, coarse hair, all come from hypothyroidism. Risk of hypothyroidism. With untreated hypothyroidism, we're going to increase your risk of cardiovascular disease, osteoporosis, infertility, cognitive impairment, fatigue, and weight gain and obesity. Hypothyroidism leads to heart problems, high cholesterol, weight gain, joint pain, pregnancy problems and infertility, and worst case scenario, myxedema coma. Hypothyroidism also contributes to sexual dysfunction. In women, when we have hypothyroidism, we're going to have more painful sex because those cells in our vaginal area aren't going to be as nourished with the thyroid hormone that they need to be. We're going to have hypoactive desire disorder, just no desire to have sex either. Everything's very sluggish and sloth-like when we have hypothyroidism. In men, they can have ejaculation issues and erectile dysfunction issues. The overlap of these two sexes is a decline in sex drive overall, fatigue, and depression. Many of you come to my clinic saying, but my doctor says my thyroid is normal. This is because traditional medicine teaches that thyroid disease is diagnosed on TSH. Normal lab TSH ranges from 0.3 to 5, so we have this huge range of TSH. More importantly, 84% of patients are going to have a normal TSH level, even when they have hypothyroidism, they have symptoms of hypothyroidism, which we refer to as subclinical hypothyroidism. Triiodothyronine, also known as T3, this is the most important, most active thyroid in our body. It's required by every organ and tissue of the body. When we talk about T3 is significantly more important than TSH, and pretty much I hinge all of your lab tests on what your T3 level, or all of my treatment rather, on your T3 level. I don't even really care about your TSH at all. And this comes from studies that were done all the way back in the 1980s. It demonstrated that TSH marker cannot reliably be used as a thyroid function marker. T3 is the only truly reliable marker of thyroid function in your body. And I just want to go back to this little picture. And this is what you guys come into me with all the time. T3 is triiodothyronine, and that's where we're going to go from TSH. That's your brain saying, hey, that talks to your brain, that thyroid stimulating hormone saying, I want more thyroid. All the cells in the body send messages back to your brain. And it's saying, I need more thyroid. That's where the TSH comes in. The TSH talks to your thyroid, and it tells your thyroid, hey, push out this thing called T4. And then in other places in your body, that T4 is going to be converted into T3. And that's, along that whole pathway, is where we can get hiccups. So many of you come to me looking like this person. We're overweight, you have a large thyroid, you have all the symptoms of thyroid disorder, but your doctor will say, well, all your labs came back normal, so you don't have a thyroid problem. And that's because they're utilizing TSH or free T4 only and not looking at your T3. These studies were done in the 1980s that show that TSH is not a reliable marker. T3 is your only truly reliable marker. What things can impact your T3 levels? Peripheral tissue levels of T3 are impacted by numerous disorders, including stress, chronic illness, diabetes, insulin resistance, obesity, depression, chronic fatigue syndrome, fibromyalgia, amongst many others. So many things can affect your T3 levels. Why are my thyroid levels fluctuating? Also, it can be different medications that you're taking. The medication timing and food interactions. This is huge when we talk about, when I put you guys on desiccated thyroid, MP thyroid or armored thyroid, the time of day that you take this is crucial. We call it a princess pill. Thyroid medication does not want to be mixed with anything else. You need to be taking your thyroid medicine 30 minutes before you put anything in your body, and this includes coffee. If you put anything else with thyroid, it's going to attach very cleanly. It's going to attach right onto anything else in your belly, and then it's just going to go out in your poop, and it's never going to affect your body. So when I give you thyroid medication, you need to be taking it 30 minutes in the morning before you take anything else. I really recommend that you get up and you take it, like you go to pee at 5 o'clock in the morning, that's when you should be taking your thyroid medication. Other things you should be taking is like herbs or supplements. Those can interact with your thyroid medicine. Certain foods are going to interact with your thyroid medicine. Changes of the season, hormone fluctuations, and pregnancy. All of these things can affect your thyroid levels and functioning and how well your thyroid medication is working. Nutritional deficiencies are a huge component when we're talking about thyroid absorption and thyroid efficiency. Essential vitamins and minerals that allow for optimal thyroid performance include zinc, selenium, iron, vitamin D, and iodine. Unfortunately, the American food is so nutritionally deficit for numerous reasons, especially over-farming and different things that they use to make foods grow faster. So the foods that we're eating are typically nutritional deficit, even though we feel like we're eating a balanced diet. There are good foods and bad foods when we talk about thyroids. Good foods are nuts, lean meats, lemons, walnuts, and honey, vegetables, various fruits, coconut oils, shellfish, seaweed, kidney beans, pumpkin and sunflower seeds, orange juice, wild-caught fish, probiotic-rich foods, eggs. Bad foods are going to be your raw, cruciferous vegetables, fluorinated water, caffeine, alcohol, soy foods, fast foods because of the preservatives in those, carbonated soft drinks, gluten-containing foods, processed meats, refined vegetables, refined sugar, and foods containing sugar. Unfortunately, the bad side is predominantly what the American diet consists of. The left side of the screen there was pretty rare for the American diet, and that's why the Americans are one of the worst countries when we discuss thyroid issues.
Can we get a copy of that?
Absolutely.
Yeah,
Selenium is your friend. Selenium and iodine. When we talk about thyroid, selenium and iodine are your go-tos. Selenium is what's going to help you convert T4 into T3. Patients with Hashimoto's demonstrate a 40% reduction of TPO antibodies when given simply 200 micrograms of selenium a day. And selenium, that's a handful of nuts. It's amazing. Selenium is so easy to get.
What's Hashimoto?
Hashimoto's thyroiditis, I'm going to go to in a second, but basically it's your body attacking the thyroid. Yeah. Iodine and thyroid. In order for the thyroid cells to work, they need iodine. That's how we make thyroid hormones. If you do not have enough iodine in your body, you cannot make enough thyroid hormone. And all of us have now moved to using Himalayan salt and sea salts and all these fun salts, and none of them are iodized. So when we were children, all of us had iodine salt. That was a huge thing. Everybody had the normal salt, and then we had this huge backlash to salt is bad. Salt causes blood pressure issues, salt causes all these problems, right? Well, now all of us have an iodine poor diet because we love Himalayan salt and sea salt, and I also love it. I get it. But now where's that iodine coming from? It used to be in our salts, and none of us get it that way anymore.
Unbelievable.
The 3 causes of low thyroid are decreased production overall, decreased conversion of T3, that should be ripped, I'm sorry, decreased poor conversion of T4 to T3 in the peripheral tissue, and receptor site insensitivity. And this is a tricky one, because receptor site insensitivity, your labs, including your T3, can be completely normal. All the blood levels can be normal, but the cells don't want to accept the thyroid into it. And so with patients who have all these symptoms of hypothyroidism, even if your labs are basically normal, I'll still trial you on a low dose of thyroid to see how you feel. You get on that low dose of thyroid, and then all of a sudden you're like, wow, I'm feeling so much better. I can't believe this. And it's because you probably have receptor site insensitivity. Your blood levels look okay, but we need to actually make your levels super therapeutic so that the cells will actually want to accept the thyroid onto them. Decreased conversion is a big problem. So we're talking about converting T4 to T3. So your brain sends a signal to your thyroid. It says, hey, make thyroid because the cells are demanding it. So T4 then needs to be converted into T3 in your liver. Mostly, the liver is going to do the job of that. T3 is also going to be your intestines, about 20%. And then some of it gets to this reverse T3, which we'll talk about later. And then barely any is actually made by the thyroid gland itself. Only about 7% of your T4 converts into T3 in your thyroid gland. We really depend on that liver to be functioning optimally to make that T4 convert into T3. And that's where that alcohol that we talked about earlier, why alcohol interferes with thyroid, because alcohol, your liver is only going to take over processing that alcohol. The liver is only going to take over processing the fatty foods if you put those into your body. And it's not going to take the time to want to convert your T4 into T3 as well. And then a lot of Americans have fatty liver disease, so their liver doesn't function as optimally as well. There are thyroid receptors thyroid receptors are found not only in the thyroid gland, but also in your brain, your bones, your heart, your liver, muscle, and your mitochondria. And that's what we're going to talk about now. We're going to talk about cellular health. Mitochondria are amazing. This is my favorite organelle that we have within our cell. Mitochondria are your powerhouse of your cell. It's the coolest organelle there is. Mitochondria is where all your energy in your body comes from. When cells need more energy, mitochondria reproduce. So the more you exercise, the more you use energy, the more you push yourself, the more mitochondria are going to start reproducing within your cells. If you exercise less or use less energy, those mitochondria will die off. Mitochondria is what produces ATP, and ATP is what gives you energy. ATP is crucial for your muscle contractions. And more importantly, ATP becomes ADP, and ADP is essential for RNA and protein synthesis. This is more like a sciencey thing, but I just want to show you guys how complex this system is within the mitochondria itself when we add thyroid into it, when we add T3 into it, how essential it is to make this is everything happening within one cell and one part of your cell, constantly. Thyroid is crucial to make mitochondria work. Optimizing T3 levels is paramount to cellular performance. Feel better. When the thyroid hormones are optimized, your patients will feel better. Combination T4 and T3 therapy show a better quality of life for patients than T4 therapy alone. And 49% of patients prefer to combine therapy. What I'm saying here is most people are like, my doctor put me on Synthroid. Synthroid is only T4. There's no T3 in Synthroid. I don't know why this move happened in medicine to support Synthroid so much. It's not a combined thing. And if you're missing any of those other pathways where you're having issues converting T4 into T3, then it really doesn't matter how much Synthroid I put into your body. It's not going to do anything to help you feel better. It's not going to do anything for your cellular health. Low T3 and subclinical hypothyroidism is also associated with increased cardiovascular disease and mortality. The reason is with hypothyroidism, your heart muscle pumps too weakly. It doesn't have that good pump into it because of the ATP and the muscle contraction we talked about earlier. So your blood vessels start stiffening. Then we're talking about higher blood pressure issues. We're talking about higher cholesterol issues. In heart failure patients or following acute myocardial infarction, thyroid testing is recommended to restore thyroid hormones to levels which have been shown to improve ventricular modeling and contractility. Overall, patients who have had a heart attack or have heart disease are going to do better if their thyroid is optimized. This is more about Hashimoto's. So Hashimoto's, basically your body produces these antibodies. All of a sudden, your body says, your thyroid is foreign. It doesn't belong here. That's what antibodies do. Your antibodies' job is when we have an infection or a virus or a bacteria that comes into us, our body is supposed to recognize this foreign, wall it off and say no, and then cause an inflammatory response and reject it, right? And try to kill it off. Well, unfortunately, our body starts finding our thyroid to be foreign, and then it starts attacking it and wanting to kill off our thyroid. The thyroid becomes enlarged and angry, and we develop all the symptoms of hypothyroidism. And some people have a mixed state of hypothyroidism and hyperthyroidism because of Hashimoto's. The damaged thyroid then just leaks hormones and it just doesn't work efficiently. Autoimmune thyroiditis, Hashimoto's thyroiditis, is the most common cause of hypothyroidism in the United States.
Could you say that last sentence again?
Hashimoto's thyroiditis is the most common cause of hypothyroidism in the United States.
And what's hypothyroidism?
That's the low thyroid, like when you have thyroid dysfunction and your T4 isn't converting into T3 and you don't have enough T3 to feed your cells. Hashimoto thyroiditis is a condition where the body's immune system attacks the thyroid gland. It's often hard to diagnose and it can present in many different ways. The main treatment is through dietary modification and vitamin and mineral supplementation. We have this amazing pharmacist that we work with that's called Isabella Wentz, or whose name is Isabella Wentz, who has extensive personal history and clinical experience. She herself has Hashimoto's thyroiditis, and when she got that diagnosis, she decided to find a way to take care of herself. So her website can be found here, and then that's her QR code, but a really amazing pharmacist, and we definitely subscribe to what she believes in. With Hashimoto's protocol, you want to avoid gluten, soy, dairy, corn, alcohol, sugar, and caffeine. You take 500 milligrams of magnesium at night.
Everything good.
You know, right? You take thiamine 100 milligrams a day and selenium 200 micrograms a day. That's the equivalent of 2 bristle nuts. And that is her treatment protocol for Hashimoto's, and people seem to do excellent with that. And that's, of course, in conjunction with the desiccated thyroid that I put you on. Treatment is imperative. In order to feel optimal, the treatment of the thyroid condition is imperative. The thyroid regulates your temperature, your metabolism, your brain function, and your energy. Treatment includes desiccated thyroid, which is my preferred porcine. There are no synthetics involved with that. You're getting a completely natural thyroid. The difficulty with this is it is pork thyroid that's ground up. So for certain religious reasons or vegans or vegetarians, I have to find alternate options for them. But for the majority of my patients, desiccated thyroid works amazingly. The brands you're going to hear are MP Thyroid, WP Thyroid, Armor Thyroid, and Nature Thyroid. This allows for dual therapy. You're getting T3 and T4 when you're using desiccated, unlike with Synthroid where you're only getting T4. Some patients need to be on Synthroid plus Cytomel because that's going to be the T3, T4 compound, but it's pretty rare that I have to do that. With that, they are going to be exposed to synthetics, and I do try to avoid synthetics whenever possible. This is a little bit we talked about before. I'm thankful to be alive, but I still am pissed that I have to wait to drink my coffee, and that's because you have to wait 30 minutes after you take your thyroid medication, or it's just going to bind to that caffeine, and you're just going to poop it out. Tips for taking your thyroid medication: you want to avoid calcium consumption within 3 hours of taking the medication. This guy loves to bind with anything. It's like a little magnet. So anything else you put in that belly, it's just going to want to stick right to. So within 3 hours, you want to avoid calcium products. You want to take the medication every day at the same time of day. Try to hit that early morning, or I work night shifts sometimes, so I have to mix it up. But you want to take it 30 minutes. Try to get it on at the same time every day. You want to eat foods that are, we already talked about a list of foods. We want to limit those bad foods as much as possible. And you can always call us and find out if there's anything about your symptoms that are worsening or you're concerned about your dosage. We can play with that. I want to show you a picture of this person. This is a lady from Canada who's named Tanya Smith. This is her kind of weight loss. This is from 2001 to 2017. And initially she was just given the pre-diagnosis hypothyroidism. They get her on Synthroid. She's still struggling mentally. She's still having sleep apnea. She's lost some weight, but not a lot. 2011, they still have her on Synthroid. Her low to normal T3 is ignored basically. She's still struggling mentally. They just keep giving her more Synthroid. They're telling her there's nothing wrong with her. Finally, she goes to a gluten-free diet on her own, doing her own research, still on Synthroid monotherapy. The gluten diet does help her. Finally, we get her on an only on T3 mono, and with the diet, she has mental clarity, she has balance, she's at an optimal weight. So she has to go over 16 years with providers constantly just putting her on Synthroid, just telling her she needs Synthroid. She feels miserable for 16 years. She comes up with herself to change her diet and get rid of that gluten, and that helps her tremendously. She loses weight because of the gluten-free diet. She feels better. Once we put her on T3, everything's great. In summary, the thyroid affects every single cell of your body. Mitochondrial health equals cellular health, and mitochondria depend on T3. Free T3 levels should be the standard for assessing thyroid function, not TSH, not free T4. Diet is important to your thyroid function. You want to limit your stress. Thyroid optimization is crucial for hormone optimization, and desiccated thyroid is the preferred option for the majority of patients. Any questions?
That's a lot of information. That's really good.
There's a lot of information at once. But thyroid is complex.
Yeah.
And I can tell you, like, when you're in medical school, endocrine system is one of the harder systems to learn. And learning about thyroid and hormones and how they operate is really difficult. As I showed you some of those pictures, of how complex this system is when we talk about ATP, ADP, all these different things that people's brains just want to shut off to. They don't want to hear it. But mostly I want to spread the message is current medicine is practicing wrong, like it is. In Western medicine, allopathic medicine, whatever you want to call it, does not have the full clinical picture. And many people are being neglected because their thyroid isn't being properly managed. And they're being put on antidepressants and anxiety medication, weight loss medication, blood pressure medicine, cholesterol medicine, 17 different medications. They finally come to our clinic here. We check their hormones. I put them on a small dose of testosterone, and I put them on some thyroid medication, and their lives change for the better. Now, not everybody can tolerate thyroid, so I'm not trying to act like this is the end-all, be-all, this is the answer to everything. People get palpitations, they get tremors, they get irritability. Some people don't tolerate thyroid well, and I have to take them off of it. But for the majority, 90% of my patients, if not more, it is life-changing to just have a little bit of hormone optimization. And so if we can get this message out, and you can tell your friends, you can spread this out, you can really help other people. Your friends and family can be benefited by understanding this information. But I went to my doctor and they said nothing's wrong. Obviously there's something wrong. I saw you in high school and you're 50 pounds heavier, you eat better than I do, you exercise better than, you do everything right. Why? There's something missing there. And that's where that subclinical hypothyroidism comes in. If you went to one of my professors when I graduated 16 years ago, and you talked about subclinical hypothyroidism, they would have rolled their eyes at you. These are the same people that don't believe in fibromyalgia. That just means your thyroid. All of hypo, anytime you have hypo or hypo just means low, and hyper means high. That's it. So hypo just means your thyroid is often being slow or low. And hyper means hyper just like you think. Woo! Hypo just is like slow and sluggish. Just think about a sloth. Just like a slow, sluggish, ugh. That's what hypothyroidism is.
But they're so cute.
Yeah.
Can I ask you if you do, like if somebody has Hashimoto's, do you do regular lab work to check their antibodies?
Oh yeah, that's a good point. So when my patients come with Hashimoto's thyroiditis, their TPO antibodies are going to be elevated at a different amounts. So for instance, I had a patient today who came in. When I saw her, she was seeing an endocrinologist, still just on Synthroid. Her TPO antibodies were in the 5,000 range, and her labs were all over the place as far as her numbers were crazy. We ended up putting her on desiccated thyroid. Her TPO antibodies are now down to 500. So she still has the antibodies, but we have significant improvement in those antibodies. On the flip side of that, some people get desiccated thyroid, and their body reacts to the desiccated thyroid, and they get TPO antibodies from that. So whenever I have my patients here, when I do a panel for my patients, it always includes TSH, free T4, free T3, and TPO antibodies. And for a rare group of people, I'll add in that reverse T3, because some of these people convert. Reverse T3 takes away from your T3. So for some of these people, even though we feel like the T3 is a good level, they have way too much reverse T3. And then that's going to pull away. So I have to take that into account too. If you have a whole bunch of reverse T3, then your amount of T3 that I'm seeing isn't accurate, because it's almost like an eraser for your T3. So for some people, I'm like, you're on the right dose of medication. None of this makes sense. You're taking your medicine right. You're doing everything I'm saying. Their numbers still look weird. They still feel like crap. I'll add a reverse T3 onto those people. The same with my sex binding globulin. I don't always check sex binding globulin for you guys,
What's that?
but that's where your for your sex hormones, for your testosterone, your estrogen, those hormones, it binds them up inside of you. So even though your blood levels can look good, if you have a whole bunch of sex binding globulin, it's basically in there just numbing those up, and your cells can't use it. So in those patients, still the same idea is, I got your hormones right, I'm targeting you right, why aren't you feeling better? What's going on with you? Well, it's because you have too much sex binding globulin. So I need to adjust your doses based on that.